Kogi State Governor Yahaya Bello has officially launched the Enrollment of Beneficiaries into the State Health Insurance Agency scheme. Governor Bello said access to quality health care will be made available for every citizen of the state. He gave the assurance during the flag-off ceremony in Government House, Lokoja.
Access to quality and affordable health care is a fundamental human right. As leaders of the New Direction administration, we prioritize health as a core theme of our blueprint. I was determined to secure that right by law and by policy. No one should suffer or die because he or she cannot access or afford health care. The journey to the establishment of Kogi State Health Insurance Agency started on November 14, 2019, when Kogi State House of Assembly passed the bill establishing the agency. I assented to the law on April 24, 2019. The Kogi State Health Insurance Agency was envisioned to provide equitable access to quality and affordable health care for the people of Kogi State, irrespective of the socio-economic status. Our next objective is to achieve universal health coverage, that is, health for all, very soon. The establishment of the Kogi State Health Insurance Agency also put this objective within our reach. It is an open secret that expensive or substandard healthcare leaves citizens at the mercy of diseases, leading to incapacitation or premature deaths. Without favorable intervention, it can quickly push citizens into extreme poverty or even crime. We are aware that health insurance improves the health-seeking behavior of people, and there is a positive correlation between good health-seeking behavior, economic growth, and development. Accordingly, this agency must work fast to provide and expand health care coverage to our populace. In the nutshell, it is expected to move fast to improve access to quality health care while reducing the financial hardship associated with out-of-pocket expenditure for health care. Just over 1 year ago, the people of Kogi State re-elected us for a second term. This is their own way of giving us their own blessing to consolidate on our mandate. We do not take their good faith for granted. And health is one area we can work around the clock to prove that their trust in us is not misplaced. We have been investigating and investing heavily into the health sector in the last 1 year. We have the ongoing construction of world-class health facilities across the states. When completed, the reference hospital at Okene will compete very favorably with similar hospitals anywhere in the world. We also have massive construction works ongoing at the Kogi State Specialist Hospital, Lokoja, as well as an ultra-modern general hospital in Ajakuta, another one at Gegubeki, at Isondu, and across the states. Our promise for this second term is to do more. I can say with all sincerity that we have been working hard to do that across all sectors. I hereby charge the management of the Kogi State Health Insurance Agency to redouble her effort to bring our people into the healthcare coverage umbrella. I charge them to embark on intensive public enlightenment campaigns on the benefits so that the citizens are given all the information they need to key into the scheme. Our people at grassroots are especially important to me in this project. This is because they are faced with high disease burden, bearing the brunt of irregular and inadequate income, have limited access to healthcare services, suffer high level of poverty, all of which is worrisome or worsening by high birth rates and low level of literacy. The Kogi State Health Insurance Agency must understand that they carry our hopes of reducing multidimensional poverty by providing some social security, in this case, healthcare. If the agency can get her act together, and I leave her with no option than to do so, the residents of Kogi State will have the help they need from government to stem the tide of mortality and morbidities in the states. I will continue to provide the enabling environment for the agency to perform optimally and position herself against the leading healthcare insurance agencies in Nigeria. We are assuring you that the less privileged, the poor of the poor, the less privileged, the pregnant women, children that are of age not more than 5 will adequately be catered for. I have earlier set up the Bello Care Project to care for the vulnerable people. This particular project is going to cater for you. They will not pay a dime to access quality healthcare under the scheme, but they must sign up to benefit.
On the issue of security challenge, Governor Bello maintained that Kogi remains the safest state in Nigeria.
I am expecting all the intelligence security agencies to expose this heinous crime against humanity, so that Nigerians will see clearly the effort of President Muhammadu Buhari and the wonderful efforts of our security agencies. I don't know what they seek to understand or to gain from this senseless insecurity they are causing left, right, center. In any case, I am advising all my colleagues, whether you belong to APC or PDP, but as governors, let us rise up and secure our states. If our states are secured, the nation is secured. Whether APC or PDP, whose hands are involved in any form of insecurity or crime, should be exposed and dealt with decisively. When we're talking of 2023, who knows who will be alive before 2023? Why would you be causing havoc before 2023? On behalf of the government and the good people of Kogi State, we congratulate Mr. President, the governor and the government of Katsina State, and the people of Katsina State, the parents, the lovers, and well-wishers of the children that were kidnapped, for the safe return of our boys in Kankara. We congratulate and appreciate the security agencies for the wonderful job of immediately retrieving them back. If you don't know, I will reveal to you today that majority of the insecurity we are experiencing today are politically motivated.
Thank you, sir.
Those who subjected us to the situation, terrible situation of 2013, 2014, before 2015 changeover of government are at it again. They want to set you against President Muhammad Buhari. They want to set you against APC. They want to set you against those who care genuinely for you. We will not allow them. There is an extent to which we shall condone this nonsense. And I am urging all the security agencies at this point, please rise up to this challenge. You are in that position to do your work. Do your work professionally. Let the citizens of this country have that trust and confidence in you. You are doing well enough. You can't be in every street or cover every inch of the land. The people should be able to assist. These politicians who are bent on causing crimes and criminality in our societies must be exposed. And let's deal with them decisively, however highly placed they are. I thank God, in less than 24 hours, that the sponsored so-called Bring Back Our Boys took to the media, our boys are back.
Governor Bello also called on all leaders in Nigeria to ignore COVID-19 second phase lockdown proposal, said it will further dampen the economy.
I will not end my speech without making reference once again to the almighty COVID-19 second wave that is being marketed, advertised, and propagated currently across the world except Kogi State. I want to sincerely admonish and plead passionately, fervently with our leaders, with our money bags, the capitalists, the businessmen, our political leaders, our religious leaders, our traditional rulers, the influential ones, including our media. Let us have fear of God Almighty. Let us let our people be. Our people have suffered enough. We have deprived them enough. They have been locked down and they have died enough. They did not deserve all these treatments. Let the talakawas be, let them be. Allow them alone. As much as COVID-19 would exist, allow our people to develop their own immunity to fight it. Don't market vaccine. Don't be a merchant of vaccine for our people. If I produce a product and I cannot guarantee that it is 100% safe and take responsibilities for whatever happened thereafter, it is not worthy to be marketed. If the producers of this vaccine are not claiming or will not accept responsibilities for the side effects, don't sell it, don't market it, don't advertise it, don't use it to kill our people. The poor masses that are struggling to earn their daily bread should not be turned to lab guinea pigs. Don't play politics with the life of our people, with the health of our people, with the well-being of our people. If you can't provide for them, you can't fend for them, allow them to fend for themselves. I will not play politics with the life of my people. Let us not use COVID-19 to paralyze and demean and diminish the gains and achievements of this administration of President Muhammadu Buhari. This wonderful, kind-hearted man means well for us, the poor Nigerians. Let us keep our ill advice to ourselves. Let us not explore his simplicity, his belief in you that you are watching me. Don't explore his simplicity simply because he believes in you and mislead him. If you mislead him, God is watching you. But sincerely speaking, let us not try another lockdown, except we want to cripple this country. What is obtainable in another climes, in America, in Europe, in Asia, will not be attainable here in Nigeria. We don't have the same system. Our immune level is not the same. Our economy is not the same. Our culture differ. Let's talk cut and paste solution to our problems. Allow our people to move around. Allow our people to fend for themselves. And let's allow the various SIPs of President Muhammadu Buhari have impact on the people. You want to lock us down? You want to sell vaccine? You want to make it mandatory so that you will satisfy the Western world. That will not work in Nigeria. That will not work in Nigeria. Those that are committing those crimes, causing the crimes, liaising with the bandits and their leaders, liaising with the Boko Haram and their leaders, are not different from those who are planning to lock us down again because of COVID-19. Because when you do that, that is mass killing. That is mass killing. You want to bring weapon of mass destruction to annihilate humanity? I think we should have a rethink. Let us stop causing crime against humanity. May God help President Muhammadu Buhari. May God help Nigeria. May God help Kogi State. May God help each and every one of us. May we be able to differentiate between our friends and enemies. There are enemies of this country in positions today. God will expose them. Please don't be afraid to say the truth wherever you are. If they challenge you, you tell them exactly what you know. I will not come out to say anything if I don't know anything. And distinguished ladies and gentlemen, I dare anybody to prove me wrong, all that I have said. I dare anybody to prove me wrong. I will further expose them with hard facts. But for now, enough is enough.
Commissioner for Health Saka Haruna commended the governor's resilience to continue to strengthen the health sector in the state.
According to WHO, about 100 million people are being pushed into extreme poverty annually due to high out-of-pocket expenditure on healthcare, especially among the informal worker who constitutes about 75% of our population. It is on record that the New Direction administration led by His Excellency Yahaya Bello has continued to invest into the health sector, which over time has translated into improved quality of life, improved life expectancy rates, and reduced premature deaths among the residents of Kogi State. Kogi State Health Insurance Agency is therefore set up to create a paradigm shift from high out-of-pocket expenditure on healthcare to a sustainable financing mechanism capable of providing financial risk protection, equity, and quality healthcare to the residents of Kogi State. Alhamdulillah, the scheme has come at the right time, as there is no better time to get the scheme working than now, when the people are looking up to their leaders for direction in the midst of a pandemic sweeping across the globe, crippling world economies, and bringing strong governments to their knees. The success of this strategy requires the collective responsibility of multiple stakeholders to ensure sustainability of the scheme. It is our firm belief that with the implementation of health insurance scheme in Kogi State, we will be able to address the critical barriers of poor access to healthcare services. We will be able to strengthen our health system and improve our referral linkages. Consequently, I want to further add that His Excellency Yahaya Bello, in his usual magnanimity, has approved the Vulnerable Health Insurance Program, also known as Bello Care, to cater for the vulnerable segments of our population, such as the poorest of the poor in the community, people with a disability, pregnant women, children under age of 5, and our elderly people. Based on the foregoing, it is expected that the agency will commence enrollment of vulnerable into the scheme to cater for this set of people with unstable income or those with no income at all. Expectedly, this initiative will translate into increased productivity, economic growth, and prosperity for our dear people. I would like to conclude by saying health insurance for all residents of Kogi State will ultimately improve productivity and cumulatively increase the gross domestic product of our dear states. Let us all take the opportunity provided by the purposeful leadership of His Excellency Yahaya Bello to enroll into the scheme 29 years after the creation of the states. Together, we can access best healthcare services at minimum cost.
The Secretary State Health Insurance Agency and other management team said this is a welcome development at such a time as this.
Permit me to say at this point in time that Kogi State Health Insurance Agency is among one of the 34 states in Nigeria with a functional state health insurance agency. We will continue to rely on the smooth partnership we have with our stakeholder in order to accomplish our projected results. The high out-of-pocket expenditure on health in Nigeria, Kogi State inclusive, with the concomitant catastrophic health cost has crystallized into the establishment of a state social health insurance agency in Kogi State. Kogi State was therefore established to provide equitable access to quality and affordable healthcare services to all residents of Kogi State, irrespective of socio-economic status, to ensure universal health coverage. In this regard, Kogi State is in the right direction, and our target is to ensure that we actualize the objective of the agency. The agency is set to commence enrollment into the following health programs of the agency: the formal sector health plan for the state civil servant and the local government civil servant, employee of the private sector, student of tertiary institution, and the pensioners, and the informal sector plan for those that are not working with government, those that are not working at all, the self-employed individuals, in families and communities.
On behalf of the organized labor in Kogi State, Malinga Obaka endorsed the agency.
We have dialogued with the executive secretary of the agency, and he has explained all the health benefits of this scheme to us. And the organized labor in Kogi State who have embraced the agency. Your Excellency, we're also happy for the contribution of Kogi State government towards the actualization of this agency. It's a sacrifice.
Would-be beneficiaries also appreciated the state government's good gesture to provide adequate healthcare services that will be accessible by all persons in the state.
We are very close to the grassroots. Most of our health hospitals or clinics or health centers, there are some drugs that the Commissioner for Health have sent to most health centers at the local level, free of charge. Like in my own area, in Basa local government, we have about 5 centers that are free. What the federal government did for many years now, Kogi State have just started its own for the benefit of the vulnerable and those that are left with, just as the governor have mentioned. It's a very good innovation, and this is part of dividends of democracy.
We are happy because he has given us a good development. To help the poor masses, we thank God for His Excellency to introducing the health scheme insurance for those people that are not able to pay for their hospital bill. Well, we thank God. It's a welcome development, just as it happens in other states. We Kogi State, we are going to benefit something, just like NHIS. We thank God.
Present at the event are Deputy Governor Edward Onoja, Secretary to the State Government Ayoade Folashade, Chief of Staff to the Governor Abdulkarim Muhammad Jamiu Asuku, and other top government functionaries. The event was also spiced up with entertainment. The State Health Insurance Agency Bill was signed into law in April 24, 2019 by the Executive Governor of Kogi State. Please subscribe to our YouTube channel, Confluence Chronicle, for subsequent editions of Kogi State Governor and Government activities. This package is from the Office of the Senior Special Assistant on Electronic Media.